I'm Dr. A GP based in the UK. So have you got symptoms that no one can treat or your doctor doesn't know what to do with? So fibromyalgia is a diagnosis of exclusion. Firstly, I think it's very important to actually know what a diagnosis is. So a diagnosis is essentially a group of patients who have the same symptoms, the same lab findings, examination findings, and they all bunch together to give a diagnosis. And the great thing about a diagnosis is it opens up a key to treatment plans. And if you don't fit into a specific group of symptoms and get no diagnosis, that's where we start talking about diagnosis of exclusions. Obviously, I've mentioned fibromyalgia, but every specialty has one. So in dermatology, there's idiopathic pruritus, where there's itching without a known cause. In ENT, there's burning mouth syndrome. And in gastroenterology, there's IBS. As you saw at the beginning of the video, fibromyalgia is a very, very debilitating condition for those who have it. It not only causes widespread pain, but it can cause fatigue, brain fog, just to name a few of the symptoms. It's a very misunderstood condition, and because there's no formal treatment plan for it, treatment can vary and patients sometimes are suffering for a long time with their symptoms. Just because there's no formal diagnosis or treatment plan for fibromyalgia doesn't mean the patient's symptoms are not real, and the very best doctors or the very best treatment plans I've seen are the ones where the patient's symptoms are linked down to the very basics of physiology, and doctors are able to link their symptom to a specific part of physiology and apply that, taking into account the patient's history, both in terms of lifestyle and medical history, and then come up with a very tailored treatment plan that is specific for that patient. Now, the first part in any diagnosis is doing all the investigations of the blood tests and examinations, so please make sure these are all done before you diagnose with fibromyalgia. Then after that is the hard part, and patients' records help. Doctors documented everything they find helps. But everything matters when you're managing a patient with fibromyalgia. So what makes it better? What makes it worse? What time of day? How is exercise? How is their mental health? How is their work? Do they smoke? And every detail is very important. I think the key thing is listening to patients, because I think if you listen to the patient for long enough and hard enough and link that in with their history, the examination findings and their blood tests, you'll be able to come up with a really good treatment plan. And this for patients who have fibromyalgia. I think if you can just document all your symptoms and come up with the journal to the doctor, that will help, especially in cases where the appointments are only 10 minutes or in 15 minutes.